Is that now fine?
Yes, sir.
Is the video fine?
A little bit down, sir.
Yes, sir.
Your face is not visible fully.
No?
No, sir. Little bit down. You have to down your webcam.
Sir.
No, up your webcam, sir.
Sorry?
You have to move upward.
Still 480 you are able to see, sir.
Now?
Now it's
Yeah,
okay, sir.
okay.
Now it's okay.
Now it's okay, sir.
Yes, sir.
சொல்லுங்கம்மா ஸ்னேகா.
Yes, ma'am. Elome fine, sir.
So welcome, sir, Dr. Balaranganavan, sir.
Yeah, very good morning, guys.
Thanks for your acceptance, sir.
Welcome, sir.
Perfect.
sir.
Thanks a lot, guys.
Sir, Dr. B. Vanadi madam is our HOD, sir.
Good morning.
Good morning,
Vanti.
sir. Good
Very
morning,
good morning.
sir. Good morning. Thanks for accepting your our invitation, sir.
My
It's
pleasure.
a pleasure
Sorry
to
for the
have
beard.
you
It's
here.
a weekend, so very sorry for the beard.
Okay, sir. Okay, sir. Okay. Now it has become a fashion, I think so. So trend has become a trend.
Thanks a lot. Guys, you guys are really rocking. So let's work it out further. I know Dr. Sandil for more than a decade, for nearly 10 years.
Okay.
Sir,
So we'll sort it out how we can take it up further.
Mr. V.S. Venkatesh is co-coordinator for this symposium, sir.
Venkatesh, Mr. Venkatesh, you are doing great.
Yes, sir.
Doing great.
Yes, sir.
We'll take it further.
Yes, sir. We
Yes,
can
sir.
start.
Yes, sir.
Surely,
It's a casual
sir.
talk, right? Now for
Yes,
the
sir.
time being, it's a casual talk, right?
Yeah, yes,
Yes.
sir.
Yes, sir.
Perfect. You tell me when I need to stop. I need to zip my mouth at that time. I zip it, and then we can take it further.
Sure,
Okay.
sir.
So it's basically what we wanted is. Let me tell you, Venkatesh, because you
Yes.
are handling the undergrads, right?
Yes, sir.
Right. So it's basic on cancer research, and then where computer science help cancer research.
Okay. Yes,
That
sir.
is the
It would be a very useful information, sir.
Perfect. Thank you very much.
Because yes.
I will. Okay. I don't have an aircon at home. I don't use aircon. Wherever I may be in the world. Only in the hotel I stay. When I switch on the aircon. Is that a fan noise? Is that okay? Or is it too loud?
It's okay, sir. It's okay.
It's okay, sir.
Okay.
It's okay.
Thank you very much. Okay. So guys, Venkatesh. Venkatesh is Venkatesh, right? Fine.
Yes, sir. My name I am assistant professor here in this Valiama Engineering College, sir. I and Dr. Muthu Sendil sir are organizing, sir. Okay. No issues, sir.
Sorry, I thought you were the student coordinator.
Okay, sir. Okay.
Student.
No, sir. No issues, sir. No issues.
நல்லா கலகறீங்க, நல்லா ஊரையா மாத்துறீங்க.
Okay, sir. No issues, sir. The thing which you told, sir, about this, how computer science will be useful for this cancer research. Okay, actually, many students they won't be knowing, so it will be very useful, sir. For your knowledge will be very useful for all the students, because today many people are suffering from cancer. We have seen that in our surroundings. So how the technology which we are using in this CSE, it will be how it can be used for curing this different variants of cancer. Okay, it will be very useful, sir. We are very eager to listen from you.
I am on LinkedIn.
Yes.
Okay, Venkatesh, we can start now, I think.
Okay, sir. Okay. Yes, sir. You can start, sir. So, welcome to one and all. Okay, welcome all the participants, and welcome Dr. our chief guest of today's event, Dr. Balu Ranganathan, sir. Welcome, sir. Welcome our HOD ma'am, our honorable HOD ma'am, for providing us a very good support for conducting this event. Thank you, ma'am. And welcome all the guests who are guests as well as participants, and all my department staff members who are present in this team. Welcome you all. Okay, so I want Dr. B. Muthu Sendil, sir, okay, to just speak. Is Muthu Sendil, sir?
Yes, sir.
Yes, sir. You can start, sir. You can tell something.
Yeah, I think I welcome all the staff and students from our department as well as from outside the college for participating in this wonderful symposium, actually 11th National Technical Symposium conducting by the Department of CSE and Computer Science, I mean Cyber Security. Cyber Security, this is a department we are starting from this particular year. They have been joining with our core department. I welcome all the staff and students from our college as well as from other departments, other outside colleges also. I think hand over the session to Snega.
Yes, Sneha.
Yes, sir. Sir,
Snega, you can start. Who is going to be the welcome address? யார் கொடுக்கப்படும்?
third year Sivanarayanan and Sneha. Can we start?
Eska.
It,
Hello all. This is Neha from SRM VEC Engineering College, studying my third year in CSE department.
This is Sivanarayanan, studying third year in the same department. Here we are to host the prestigious CyBorGY'S 21.
Happy morning to one and all present here. Now it's time for us to get blessing from God. Here we go with E Kuttavalakku.
Yes, Deepan Suryaraj.
Is the screen visible, sir?
Yes,
Yes,
yes.
sir. Yes.
So shall I light it?
Yes, sure, Deepan Suryaraj. Okay. Very good. Very nice.
Amazing. Very nice. Your
Okay,
product,
fine.
SRM product, E Kuttavalakku.
No, sir.
Really
These are
good.
for student initiative, sir.
Yes, sir. Students,
very
they designed this thing, sir.
Awesome. Really.
With the support
Okay,
of
go
staff
ahead.
members.
Yes.
Welcome to CyBorGY'S 2021. CyBorGY'S is a national level technical symposium that is being conducted by Computer Science Department and Cyber Security Department every year. CyBorGY'S 21 is a symposium conducted by our student society with the guidance of our beloved professors. Our symposium gives exposure to students in various technologies by conducting various events. This is a grand festival based on the computer science stream. It gives grandeur exposure for students by conducting technical and non-technical events. It is a great platform for innovative and energetic people. We have organized fun, learning and creative events.
Here we welcome our final year student Sneha, the president of symposium, to deliver a welcome address. We welcome you, Syria.
Yes. Good morning to one and all present here. It's a great pleasure to welcome the distinguished gathering for the inauguration of CyBorGY'S 21. I'd like to welcome one of the most important and simple person who is none other than our principal. Nothing can substitute the experience of our dynamic principal. He has been continuously supporting and encouraging us to conduct this grand event. The three great essential to achieve anything worthwhile are mission, vision, values. We have one such person here today with us. It's my pleasure to welcome our Honorable Chief Guest, Mr. Balu Ranganathan, PhD, co-founder and Technology Director, Palms Connect LLC. On behalf of everyone gathered here, I extend a warm welcome, sir. I'm glad to welcome one of
Thank you very much for the invitation.
I'm glad to welcome the backbone of our department, our beloved HOD ma'am, who is our great inspiration, helpful to us in all the sense. I welcome you, ma'am. Welcome
thank you, ma'am.
to the head of various departments, faculty members, both teaching and non-teaching, and other departments who have always worked hard to bring out the best in us. Today's students are tomorrow's future. I welcome all my dear students who march towards success. Last but not the least, I would like to welcome all the participants from various colleges who have made an effort to be a part in this special day. Once again, I welcome you all to this memorable function.
Thank you very much
Thank
for the
you, sir.
invitation. It's a great honor.
Thank you, Senior. Here we welcome Muthukriba, second year student from CSE department, for delivering a welcome speech for the chief guest.
If you can imagine it, you can achieve it. If you can dream it, you can become it. A very happy morning to all the wonderful people who are present here. Here, we have wonderful person who has made dreams come true. On this auspicious occasion, I, on behalf of CSE and Cybersecurity Department and CyberOps team, feel privileged and delighted to welcome Dr. Balu Ranganathan Sir, PhD, co-founder and technology director, Palms Connect LLC, Utah, US. He is Anna University, Chennai. He has written articles on many emerging fields, especially
Voice is breaking, ma.
ma'am.
Voice is breaking and it is echoing also sometimes. I just check now.
We'll start. Doesn't matter. We'll start. It's okay. We'll start.
Now
Okay.
that echoing,
Yeah, it's okay now. No, it's okay, Mano. Continue.
Shall I start
Continue.
first or shall I continue?
Yeah, continue.
Okay.
No, continue that.
Yes, ma'am. He has done his PhD in Anna University, Chennai. He has written 40 plus articles on many emerging fields, especially on targeted chemotherapy of breast cancer using nanoparticles, nanoprinting, and nano-imprint lithography, needleless electrospinning technology, etc. And that has been published in many top journals. To talk about Palms Connect, they are one of the leading experts in the world for the development of the multifunctional nanomedicine system for targeted drug delivery that provides a way to formulate anti-cancer drug with minimum side effects and maximum targeted delivery for breast cancer. Sir, your hard work and dedication made Palms Connect a grand success. You
Thank
are
you.
such a great inspiration to the youngsters, and we feel blessed and pleasured to have you with us in this great event. Once again, I welcome you, sir. Welcome, sir.
Thank you very much. A very nice introduction. I wanted to be like that.
Thank you, sir. Now,
Really, I wanted to be like that.
chief guest of the day, Mr. Balu Ranganathan, sir, to deliver the inaugural address.
Okay, good morning, guys. I have shared the slides and then a small video for 2 minutes, 3 minutes approximately to you guys. I mean, to Dr. Muthu Sendil. Okay, Muthu, can you run the video first, please?
Yeah.
It will be a great inspiration for everybody.
Is it visible, sir?
No. For me, no. Yeah, fine. Go
Now
ahead.
it's visible.
Go ahead. Now it's
started.
visible.
Visible, sir, visible.
No.
Voice is visible.
Audio volume.
Voice is not no, sir.
Or else I have sent that link to, it's an open link. Muthu, can you send it to someone so that they can share it across?
I think
and
now
even
it's
deliver
staging.
them locally right to the tumor. And discovered is that by mixing the right plastics with the right solvents and the right drugs, in particular certain anti-cancer drugs, then I could even deliver them locally right to the tumor. And that would be a very good way of stopping the tumor without hurting the rest of the body. Well, a colleague of mine and I came up with this idea that if you combine plastics in certain cells, you could actually do what we now call tissue engineering, which enables you to make virtually any tissue or organ, like say new skin, or even helping people who are paralyzed walk. My advice to young people is to dream big dreams and don't give up on those dreams. Also do things that you love doing, and also recognize that conventional wisdom is not always correct. Well, a patent system, to me, is just one of the most important things in the world. There's a famous American politician who was asked what were the 3 most important things in history. And he said the printing press, the founding of America, and the patent system. And that politician was Abraham Lincoln. So our patents have been licensed or sub-licensed to over 300 companies, and I've actually gotten involved using our patents to start, I think, about 31 companies right now. It's been estimated that products coming out from our patents or the publications from our lab have helped some 2 billion people worldwide. My goal in my life is a couple things. One, I want to continue doing, basic research that I feel can change the world and make it a better place. And 2, I also want to train young students and postdocs who will go out and be the leaders of the future. And I've really enjoyed doing both.
Thank you very much for sharing that video. Muthu, can I just one more time at the initial phase, can you run the video? They will be saying 200 experiments were conducted, but they succeed only 1. Okay, it doesn't matter. Run the slides. We don't need to go back.
I will check it once again, sir. Because initial sound is not visible to us.
Try, please. Because we wanted computer science to help biotechnology. That's important.
The initial part of the video is getting breaking, sir.
No, leave it. Doesn't matter. Let's go for the slides direct.
Just a minute, it's opening, sir.
One time. Doesn't matter. It's only to the. It's only a.
Wait. 2 minutes, sir. 2 seconds.
Okay.
It's opening.
Okay.
Slowly.
We keep talking.
I think many pictures are there, no? So it's getting slow.
Yes. Okay. I don't want them to wait. I'll keep talking so that you can set up that slide.
Yeah, sure.
Okay.
Yes.
The video was. The video which you have seen across. Good morning, guys. Everybody. Thank you very much. The video which you saw right now is a biotechnology professor in Massachusetts Institute of Technology, Boston. It's MIT. That's #1 engineering campus or engineering college or engineering institute in the world. Okay. So he is a billionaire, not a millionaire. He is a billionaire. He runs 32 companies. Basically, what he wanted is he wanted to solve cancer. Okay. Am I audible?
Yes, sir.
Yes,
okay.
sir.
Okay. He wanted to cure cancer. And then he is very clear what he personally feels is definitely for sure only biotechnology cannot cure cancer. Any questions wherever you wanted to, you can stop and ask me questions. It's just a casual interaction. Okay, so what he wants is he wants to have the computer science people, mechanical engineering. He's basically a chemical engineer. Okay, so his name is Robert Langer, R-O-B-E-R-T space L-A-N-G-E-R. You can note it down and then you can web search it. Robert Langer, R-O-B-E-R-T L-A space L-A-N-G-E-R. Robert Langer. Okay, so what he basically wants is he wants cancer to be cured. And also we call that as convergence technology, where the biotechnologist alone cannot cure cancer. So he wants, okay, it has come now. Let's go ahead with that. He wants the other faculty, other domain people also to work for it towards cancer cure. Thank you very much. Full slides. The full view.
Yes, sir. Yes, sir.
It's okay, it doesn't matter. It's a weekend Saturday. Okay, let's set it. So what we are now looking into is okay, you may think why this biotechnology guy is into a computer science department. It's like this. We completely now work on data analytics. Okay, so I'm not a coding guy. My computer science, okay, thank you. My computer science team is the coding guys are my team members. So they are working on that. Okay, next slide, please, Muthu. Okay, you may see a baby lying on a capsule. So we see a lot of moon and lot of stars above the branches, right? These are the stars where they are medicines. But when you look into the bottom, you have roots, right? Different roots. So we wanted to have a lot of inputs from different category guys, whereby for each and every disease, we wanted to have a solution. That means a cure. And you may think what computer science guys can do for biotechnology. We run lot of experiments. Okay, any of you guys have contact with computer science people? Next slide. You can open up your mic and then say that. Do you have any connect with the biotechnologist? May I audible?
Yes, sir. Yes, sir. It's audible, sir.
Yes, sir.
Guys, are you connected with any one of your friends or relatives in biotechnology? Okay, if there is no answer, I assume it's no. Okay, so kindly open up and then we can have a nice interactive session. Okay, so what we say is this is multiple inputs we need to give about a single patient. This entire network is for a single patient, right? For a single patient, we need to give different criteria, that is diagnosis, something like age, tumor size, all those things, okay? And then number of tumors like that. And then use the data analytics, find it out first, whether there will be a recurrence. Recurrence means again cancer will come, okay? How long she can survive, okay? And whether she's alive or dead also, we can find it out. We need to find it out like that using your algorithms. And I'm saying algorithms cannot be patented. Okay, so you stack all the algorithms layer by layer and then make it into a software. That software becomes a product. That product can be commercialized. Am I clear?
Yes.
Okay, thank you. Next slide, please. Why this baby for a computer science department? Any clarity on that? Already there is some reading underlined. In vitro fertilization. Nobody thought 3 or 4 decades before we can have a baby you see in the lab. In the lab, in the sense, have all those sperm, egg, interaction, all those things. They never thought it's going to be outside the human system, but they made it. So cancer cure is not impossible, but one important thing is we need the inputs from computer science people. Again and again, I'm repeating, it's not that easy to run the biotechnology experiments. So many experiments, it's very, very expensive. So you guys say, okay, you don't need to do 200 experiments, just do this 10 experiments. Out of all these things we got, okay, there can be some output, which is really, what do you say, take it up for the entire 200 experiments. Next slide, please. Okay, I doubt, okay, I was having a, this is the storage devices. Everybody knows. Say like 2 decades before, I was having a computer. I bought that from Singapore. I left it somewhere. That hard disk is around, don't laugh at me, it's around 500 MB. Hard disk I'm talking about. Hard disk is around 2.5 kgs. Hard disk, I mean, sorry, around, sorry, 250 grams. Hard disk alone. Okay, but the capacity is 250 MB. It's no other choice. Okay, that's the one. And then we went over. Now, if you look into the chip, I don't have the chip. It's just 1 gram or so, and it terabytes, thanks to nanotechnology. And then about the computer science people, because we need a lot of data sets where we can work upon for the clinical estimation. And thanks to you guys to have the storage devices where we can store all the data sets or the patient data sets and then go for the analysis. We have nearly 1.2 million. Go ahead, that's fine. Next slide, please. Okay, we have around 1.2 million clinical breast cancer clinical data sets where we are working upon it. Next slide, please. Okay, this is cash, guys. Really cash. Clinical data, clinical analysis is cash. I mean, money. Money. That's the card. Okay, it's money, right? So what you do is you put all the inputs. You can see the guy is really perplexed looking into all those things. You put all the data of a single patient, do the analysis. Like that, we do the analysis for thousands of people, not even thousands, tens and thousands of people. So we wanted to take it up to next level, working on around 200,000 people, where I'm very sure our computer cannot support. So we are working upon GPU, G for Germany, P for Pennsylvania, U for Utah. Okay, it's a GPU programming. So we use R programming now, but we wanted to take it up using Python. And then for these data sets, huge amount of data sets, we cannot run your workstation and all. So we wanted to go to GPU, where again in the GPU, you cannot run the Python programming. It needs to be converted. We are in talk with few investors where, of course, they are saying they are willing to put some money onto that, but we haven't seen the money till now. Okay, next slide, please. Right. What's big data? So what we do is we need to keep analyzing. And then this big data outcome is going to be clinical decision support. Clinical decision support. It's not, kindly take it in mind, it's not a clinical decision. Whatever we are predicting is not a clinical decision. Doctor will use this decision, use this information for his decision. That's a support. We are not, frankly speaking, guys, we are not replacing doctors. They can never ever be replaced upon. Thank you. Next slide, please. Okay, this is what we wanted to, where we collect the patient information, imaging. I think many of you will be knowing what is X-ray, CT scan, all those things, right? So those things we collect, store it up, stake it for a single patient. Like that, we store for different patients and do the analysis pattern. Come up with a outcome prediction. Next slide, please. Okay, this much amount of information need to be taken up when we wanted to go for therapeutic algorithm using artificial intelligence, where when we get all this information, how long the patient can live, it's prediction. This prediction, we wanted to go it up in our software, right? Give all the inputs for that single patient and have a lot of algorithms we call therapeutic algorithm. Okay, that algorithm will run all those things. Finally, it will give a value where how long, based on all these inputs, how long the patient can live. Next slide, please. Okay, we are just at the tip of the iceberg. We call it tip of the iceberg. Everybody would have seen the movie Titanic, right? Where it hit the tip of the iceberg, right? There's a huge iceberg there, and then it hit the tip. We are also like that only. We are just on the tip. There's so much to work upon further. That's very important. Next slide, please. Okay, it's a wave now. Everybody wanted to jump into big data, data analytics, machine learning, deep learning, and then artificial intelligence. Two important things you need to know about it. How good are you in the language? Because you need to write the codes. Okay, how good are you in the language? One, if you are going to be into more of analytics, you can use R programming, or you want to take it up further levels. I think to my larger understanding, Python will be scikit, Python, learning all those things, so that later for my next discussion, I will take it up, not now. Okay, it's a big data wave now. So you need to serve. Of course, I prefer you people to have a great thinking for that. Give a good thinking for great thinking. Good thinking for that. And then let us know what further we can take it up. Next slide, please. Okay, so this is alarming. Lung cancer, especially for the mid-age people or something like not even mid-age people, like 25, 27, not mid, at the normal age, I mean, fertile age, where you need to work for your living as well as lead a very good life. But these cancers are very alarming now. Next slide, please. Okay, US scenario, 1 in 8 is suffering of breast cancer. But thanks to data analytics, thanks to you computer science guys, one you can see to my left, young girls are there. Okay, and then they were all shocking. They felt, okay, why, when even the young girls are getting affected? No, thanks to data analytics, we found out, it was found, not we, it's not we. They found out it's the early age, something like elderly geriatric people are in that direction. Something like 60, 65 plus. It's not at the early stage. Thanks to you guys. Otherwise, it would have been very confusing for everybody. Why is this happening? Why is this happening? Who is going to be affected? Because as you know, overseas, it's a difficult situation there. Immediate divorce or a breakup in the relationship. And then once when they have the children also, it's not that easy to, to groom and then to bring up by a single parent. It's not that easy for the children. So that's become a very big social burden for them. And then thanks to data analytics, and told the government, it's not that alarming, but basically it's at the geriatric level is 1 into 8. Thanks a lot, guys. Thank you very much to the computer science people. Next slide, please. Okay, this convergence technology, I wanted on the right-hand side, we mentioned at information sciences. See, in Asia only bioinformatics, biomedical, biotechnology like that. There they use only they call it bioengineering. So here also, you call about computer science, IT, a lot of other name. Basically, they call information sciences or computer science like that. Next slide, please. Okay, so these are the companies, pharma companies. You guys can enter into pharma companies or biotech companies also. These are the companies, not in India, but basically it's in overseas where they use data analytics, where the computer science people can join these companies. Next slide, please. This is how it works upon. Where on the right-hand side, you can, to my right, you enter PyTorch, R programming, Beta, all those things are there. But I prefer you people, if you are want to enter into very strong into data analytics, one, you can take it up R programming or scikit. That's the one for the Python. Next slide, please. I think I am done. Okay, simple. As simple as that, guys. This tells everything for me, what I have spoken. Kindly help us to reduce the number of experiments or come up with the prediction analysis whereby you tell whether the cancer, breast cancer, we focus on breast cancer, whether the breast cancer can again happen, recurrence we call it, or how long the patient can survive. Thank you very much. I'm done with that. I'm done. Thank you very much. You can reach me on my email. Next slide, please. You can reach me on my email @formsconnect.com or on my LinkedIn. You type my name, Balu Ranganathan, BALU. I think you'll be knowing my name by now, and then you can reach me on the LinkedIn. Thank you very much, guys. I'm open for any questions now.
Computer science is not just syntax and coding. We can make differences in people's life by developing new technology and applications. Sir, you proved technology together with any field can make wonders that help for the betterment of the society. Thank you, sir, for your valuable words. This really motivated us to explore more. Thank you so much, sir.
Senthil, you can stop sharing the video.
Yes, sir.
Sorry, the slide. Okay, I'm open for any questions now. Let's make it interactive. If you are not so comfortable in English, yes, of course, you can speak. You can have it in Tamil also. Just go ahead. Any questions is fine.
As participants, you can ask any kind of questions with sir. Any kind of doubt or clarification that how this field will augur in future. Yes.
Sir, very good morning, sir. This is Saravanan from Department of Computer Science and Engineering, Vallim Engineering College. I have one question, sir. So, you told me that you are using therapeutic algorithm for fine. Yes. So, what is the objective of this algorithm, sir? So, how long it is good for prediction of these breast cancers for the patient's life?
Okay, we made it into phase 1, phase 2, phase 3. Initially, we all work upon all those regression analysis, all those things, because we have nearly 140 variables for a single patient. Okay, so the entire 140 variables, you cannot take it to machine learning or deep learning. It gives, because we need to go for data cleaning. Okay, so we clean up all those things and then take it up to machine learning, naive Bayes, random forest, all those things. Find out what are all the variables really very critical for taking up for that. Then the next phase, phase 3, we need a lot of money. We need millions of dollars, not even millions. It's more than that, whereby we wanted to predict using our algorithm how long the patient can live. We are not into it because that needs artificial intelligence. It's not that easy. They will sue us and then they will finish us forever.
Okay.
If we say the patient, the doctor says, no, you will be living only for 5 months. Then the patient comes very coolly with a coffee and sees the doctor, I am living for 8th month now. Doctor is finished. Correct?
Yes, sir. Yes.
So that needs a lot of money and then it needs artificial intelligence inputs. That is our phase 3.
Okay, sir.
Any further question? Any further? Just, I think undergrads.
Sir, what are the reasons people get affected in the early ages of these diseases, sir?
It's basically like what I'm saying is sedentary. That is no physical activity at all. It's affecting the entire world. No physical activity at all.
It's the only main reason.
Physical activity and stress. Yes, for everybody, ambition counteracts ambition. When you drive a Japanese car, you feel like, okay, I want to drive a BMW, German car.
Okay.
When you have one home, yes, you feel like, okay, why not we buy one more home? Yes, of course, ambition counteracts ambition. When you are a professor, yes, you want to target to be a vice chancellor. Of course, everybody wants to reach different levels, no doubt in that. But health also need to take care. We need to take care of health also. That's quite important, right? Physical activity is nearly zero. And I think many of you people may not be knowing, in Europe, there is a major problem now, sleeplessness. They are not able to sleep properly. Okay. That's the major problem. So they end up in a lot of neuro problems. And you know very well in Europe, most of the medical things are taken up by the government. So it's becoming a burden for the government.
Okay.
Any questions?
Thank you, sir.
Thank you.
See, participants
And
make use of.
Just throw up any question.
Yeah, make use of Dr. Balu Ranganathan. He is the IIT from Anna University product and MIT product actually.
Once I was in MIT, Boston. So it's like this, guys. Experiments, all those things, equipments, all those things. Even many of the places in the world they have it, but it's only how they interact with other department is making the crux. They are making the difference. How they interact.
So good morning, sir. My name is Dr. Good morning, sir. My name is Dr. Nakoti. I have a question for you. Sir, you were talking about the psychological effect of a human being causes cancer. But many people say that eating non-veg is also a major reason.
No. You eat non-veg and then you walk, everything will work out. You eat non-veg and you sleep, nothing will work out. It's physical activity. You eat, basically, I don't want to go personal things. Vegetarian by, I travel a lot of countries. I cannot be a vegetarian there. When I cannot meet up a friend, I cannot say, no, I want to eat only vegetarian. I meet the local guys there. So I cannot say, I cannot be choosy, those things. So I have to give it up all those things. Right? You eat a good biryani and then I watch TV something and then go to sleep. Finished. That one doesn't work out. Veg, non-veg, they don't bother. Nobody bothers. But as long as you eat something and then take up life in a different way, like walking, physical stress, all that's what I'm saying. See, you saying about food, vegetarian or non-vegetarian, that is be one of the parameter when we take up the data sets for Indian patients. There is no vegetarian, non-vegetarian. Am I clear? You said a very good thing. Whether non-vegetarian people will get cancer or it's not like that. Non-vegetarian people are more prone to get cancer, or vegetarian people are more prone to cancer. Like that, we can have one single variable for a breast cancer patient, and then definitely we need to ask that patient. Okay, assume I cannot mention hospitals and all. When a patient goes into an hospital, okay, hospital A, that doctor should have definitely in the data, in a case sheet, vegetarian or non-vegetarian. So like that, when they collect that information for 100,000 people, that variable, vegetarian or non-vegetarian, you guys, computer science guys, can find it out. Who else is having prone at what age sector? Am I clear? Because definitely age will be there in the case sheet. That's all. Go ahead, guys.
So you mean to say that the stress is the major reason?
Yes, sir. That's not the reason. That's not the only reason. Too much alcohol, too much smoking. No physical activity, sedentary. Because now overseas they are asking how long you are having a physical activity. That has become now a very important parameter. And thanks to you guys, computer science guys also, you ask the doctor, because these inputs need to come from different sectors. We never thought sedentary by just sitting across will take cancer, will bring cancer. We thought by sitting across, okay, you are good, very good, you are very safe, and you are living a normal life. No, that's exactly opposite now. That's opposite now. So this important factor has now a case sheet. They call it case sheet. When some patient goes for an inpatient, they'll write the case sheet. Name, age, all those information. So now they are taking up this also, sedentary, how long, what is your physical activity, how many hours per hour you walk or you move around from your table. Those parameters are definitely thanks to you guys. We never thought biotechnology, healthcare doctors never thought by just sitting across we felt, okay, by sitting, you are safe. No, it's opposite. Same way, you mentioned vegetarian, non-vegetarian. Many parts, in India, yes, that's a major criteria. So they will definitely take it up. Next question, please.
Thank you, sir.
Thank you, guys. undergrads.
Students, if you have any questions, you can ask. Because it's a golden opportunity, you can collaborate with SAR also. And as SAR is pointing out, computer science plays a major role in the research with respect to biotechnology and curing cancer. So it's a golden opportunity for you peoples to interact with him, to post your questions.
And one more thing, one more thing I want to specify. Actually, doctor is wanted for internships also. The company offers internships also for the students. If really the students are more innovative and more interested over data analytics in the field of biomedical, then definitely you can contact sir. Actually, he has plenty of opportunity for giving internships to the students, even for third year as well as final years. And we, of course, we plan to make a MOU with sir. Sir, I may request along with my HOD also. So we are inviting to make a MOU with our core department to at least give an opportunity for at least internships also, sir.
We are open for that. We are willing to sign a MOU.
Thank you very much, sir.
Thank you, sir.
Definitely, we can work on that. Okay, then is this book visible to everybody?
Yes, sir.
Yes, sir.
Okay, it says Yen Yadharku. I think many of you people can understand Tamil. It's by author Sujata. I really like that guy. Yen Yadharku Yappadi. Why? It's very simple. You need to ask questions. That guy was a computer science guy. And that guy was the writer, film writer for Indian, not Indian too, for Indian, lot of movies. Right? He brought the computer science to the local people. By very simple questions. So that's the way. What I wanted is I want you guys to ask questions. Let it be very crazy.
No more,
doesn't matter. Yeah, he's no more.
No more.
Yes, correct. He's no more. It's a big blow for us. For if we have been there, coronavirus would have been the inputs. What we got for the coronavirus would have been different. Definitely would have been different. Okay. Any questions? I think all of you can speak Tamil. I think understand Tamil. Feel free. Or any language. English is fine for me. Absolutely fine.
Students, more than 212 participants are there. Professor, 212 participants. Yeah.
212 participants.
Okay, I think it's a weekend, so it's very easy. You mute and then switch off the video and then go off. Right, that's easy. That's the easy way out. Or they would have not even woken up from their bed. Yesterday, 3 o'clock, 4 o'clock. So Friday night, okay, let's have a nice time. Tomorrow, one guy is going to talk. Okay, let's mute. Let's have the switch off the video. And then let's be in the, yeah, that's okay. Doesn't matter, guys. As long as you take something like Bob said, we call Bob, Robert Langer. He said, is technology. He doesn't say is technology. He calls is lab technology. You need to have it out in mind, guys. He says his lab technology is really making an impact on 2 billion, B for Bangkok, 2 billion people. So he's a biotechnology guy, and then he is interacting with a lot of computer science people. He's now starting interacting with Google. And to my understanding, there is something called Google Health. Google Health. They have come up with no other choice. You cannot be completely on IT. IT is saturated. What you want, everything has now till now achieved. What next? Healthcare. Healthcare is money. Blood is money now. We saw, right, during Corona pandemic time. Pulse oximeter, you know pulse oximeter. Everybody knows what is pulse oximeter now. You cannot say, no, I am a computer science guy. Everybody knows. That was selling for 3,000. That's worth is again due to computer science. You got that values, all those things, and that data was reaching to different hospitals. Different hospitals I have it inside. That pulse oximeter add the Bluetooth operations also. Bluetooth parameters. Start sending the data to the doctor also. Okay. Any questions?
Sir,
go ahead.
My name is Neha. I want to know what are the benefits and risks of each of these treatments.
Come again, I'm sorry.
Can you hear me, sir?
Yeah.
Yeah, I just want to know the benefits and risk of each of these treatments.
Treatments, risk treatment.
Okay, benefits and risks of the treatment or the prediction outcome.
Prediction outcome and both treatments.
Perfect. As I already told you, Sneha, you are in the final year.
Yes, sir.
Great. See, it's a prediction is we are only, I have already written it down. It's a clinical decision support. It's not a decision. You are not a doctor. I am not a doctor. And nobody can replace a doctor. Right? For the doctor's decision, they have a lot of drugs. Writing up the drugs for breast cancer patients. So this prediction will shift or will be moving around in a different direction for the list of therapy. I mean list of drugs. Okay, this has got the out. This got the prediction. Okay, let's try initially itself for a different dosage, different drug, because we are sure there is no recurrence. We have already predicted there is no recurrence. We have already predicted the patient is going to live for 10 years. Why load all the drugs? Initially itself, they may change the drug regime, we call it. That's quite possible. That's what I'm saying. You are going to only support the doctor. Computer science guys, supporting the doctor, not replacing the doctor. Don't think, oh, no, I'm a computer science, I can replace doctor. No, that's not possible. No, that's not possible.
Thank you, sir. Thank you.
You can reach me on LinkedIn. I'm fine with that. You just type on LinkedIn, follow Ranganathan. I can be reached up there.
Sure, sir.
So any other questions from student side?
200 people. Okay, now this is the time. Guys, the organizers, can you give me one more opportunity where very selected people, by now they would have at least listened to what I am talking. They doesn't need to interact and all. At least they would have kept the speaker on. Maybe many of them would have even muted that speaker also. That's okay. So those who have listened to that, in case if they are interested, yes, we can have a more technical discussion. I'm not stealing, right?
Yes, sir,
Sneha,
definitely we'll be having it, sir.
Thanks
We'll
a lot.
definitely
Thank you.
have it,
Sneha.
sir.
Yeah. Sneha,
Sir?
we are not going, the company is not going to steal your ideas. No. Don't think that we are going to steal your ideas. No, it's not like that. Inputs. What we are now having in your mind, we wanted to speak to a very selected people who wanted to take up data analytics, machine learning, deep learning, or artificial intelligence for their career. That's money now. That's money now. Because when I am going to come up with an algorithm for breast cancer, it should work for all types of breast cancer. I cannot say only one type of breast cancer. No, it doesn't work. Finally, when we come up with a package, that should work for any type of cancer. Any type of cancer. Okay, lung cancer. You put all the data. Okay, how long the patient can live. Whether that lung cancer again will come. I cannot say, no, this is only for breast cancer. My algorithm, my package will not be sold across. It will not have commercial value. Even when we say, okay, it's only targeted for target for a breast cancer, that's fine. Okay, they'll say, okay, accept. That's acceptable, very much acceptable. But again, you need to show there are 4 types of breast cancer. For all the types of breast cancer, our package, our software should work. Any further questions? What's the time? Any further questions?
Almost 9:50. We reached last 10 minutes, sir. Ma'am, shall we wind
Yes,
up the
sir.
session for vote of thanks?
Yes, sir. Sure.
I
Yes,
think
sir.
many
Sure, sir.
interactions are not there, madam. Students are, if you are interactive is
Yes.
Students, participants.
Yes.
I think this is not the right time to have it on a Saturday morning. I think they won't even be awake now.
I think
Sir, I feel that they are more concerned about their events, organizing their events, and
I know. Very sorry, guys. I could not. I don't have much money, so I could not sponsor any of your events. Otherwise, Palms Connect event, Palms Connect award, all those things possible. In overseas, very much possible. They
Sir,
give
your
Palms
presence
Connect award.
itself is a great award for us, sir. Your presence itself is a great award, right?
Here money only speaks, madam. Especially to you computer science guys. Money only speaks. I know very well. Python, okay, let's make it just more interactive. Those who wanted to have one-to-one interaction teaching Python to the American guys, they charge 500 rupees per hour. Just on a friendly times, it's 500 rupees per hour, one-to-one virtual, one-to-one I'm talking about, 500 rupees per hour for Python. They are connected. If not connected, 1,500 Indian, I don't want to talk in dollars and all, 1,500 rupees per hour to teach Python for a beginner. So you people talk only in terms of money, in terms of time. I spend 1 hour, how much I can get the money. So there are a lot of videos there on Python, beginners, 12 hours, 13 hours like that. What you do is you download that video, cut that video. Chapter. Keep educating. And for education, don't do that free. There's nothing called free lunch anywhere. Someone somewhere has to pay for it. Okay? So when you want to teach it to this background is too nice. Fine, I'm not for this. Oh, it's okay. So, okay, I think my fan, I'm not sure about that. That's okay. So what you can do that is you can start educating to the school children, school kids, whereby you get some money out of it. Whereby you also know how to educate people. So when you go overseas for your masters, you can take up teaching assistants. That's a big money there. That's a big money. You don't need to go there to the lab or nothing like that. I'm not talking about biotechnology. I'm talking about computer science. I'm talking about computer science. You don't need to be there, but virtually remote, yes, of course, you can teach them. But for that, you need a lot of experience. So this way you can do that. Thank you.
Nigarika?
Thank you, sir.
Yes.
Thank you so much, sir, for patiently clearing our doubts. And that was really informative, sir. Thank you so much.
I prefer you people to be more interactive. Or like this, don't do that on a Saturday morning. Do it on a Friday evening. Everybody will be having a nice time. I know very well. They'll be very enjoyed. They wanted. Excuse me. They wanted to have a nice time for the events. Enjoy yourself. Enjoy your events then.
Your session was very nice, sir. Very nice, informative, and that is many people they just thought about if they want to cure this cancers and all these things. Many people will be thinking in only medical lines. But how computer science technology, how you, as you told, this big data analytics, artificial intelligence, how this can play a very good, how this can play a very good role. Okay, now we came to know about this thing, sir. Very informative.
Very much appreciated. But more appreciation will be done if any of you guys are willing to take it up at the staff level first. Speak to biotechnology guys. Speak to biotechnology guys. Have a coffee. I cannot have a beer and all with the biotechnology guys. It's not the overseas. Go for a coffee with the biotechnology guys. Enough for having coffee with computer science guys. Have coffee with computer science guys. I don't say no. You speak to biotechnology people. Have the background noise here.
I think Niharika, you start giving vote of thanks, and we can.
That's all done. I'm done.
Many students are waiting for their events to go ahead.
Correct. They want to have a nice time. Enjoy.
Right. This is Niharika from Final Year CSE department. It's my privilege to propose a vote of thanks speech on this. On behalf of CyBorG's team, I extend a hearty thanks to our chief guest, Mr. Balu Ranganathan sir, who spared time from his busy schedule to grace the occasion. Today we had an opportunity to hear your thoughts, and it will surely be encourage us. And I would like to thank our HOD ma'am for stimulating us to do our best. And above all, my sincere thanks to our respected principal and vice principal sir for the immense guidance. An event like this cannot happen overnight. The wheels start rolling weeks ago. It requires a planning and a bird's eye for details. I extend my thanks to our staff coordinators and all other staff members who helped us to complete preparation for the CyBorgs 2021. Last but not least, I would thank all our student coordinators for the effort they have put in this event. Thank you all.
Thank you very much, guys.
Thank you very much, sir. Thank you very much.
Thank you, sir. Thank you,
Muthu,
sir.
next time we'll try to work it out for some finance and then support to the sponsor that at least one event also.
Sure, sir. Definitely, sir. Definitely.
Try upon.
Thank you very much, sir.
Thank you very much, guys. Have a great time for next 2 days. 2 days, right, or 1 day?
1 day only, sir. Today
One
only.
day,
Only
sir.
1 day.
Yeah, I don't want to spend even a single minute. You guys enjoy yourself. Thank you very much, guys. Have a great time.
Thank you, sir.
Any point of time you can
Thank you,
reach.
sir.
Thanks a lot.
Thank you. Thank you, sir. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir.
Sneha?
Okay, sir. Now I think people can go for their events, right?
Yeah, Madam Sneha, have you posted the link message for each and every events?
Yes, sir. She has posted.
So,
Yes, posted.
So all the participants from the outside college as well as the college, inter-college students, you just note down the links for various events and make use of it. And thank you very much. Venkatesh?
paper presentation will be carried out in paper presentation will be carried out in this link itself. Thank you.
Okay.
Sir, Venkatesh sir, shall we leave?
Okay, sir.
Have you recorded, sir?
Yes, sir. It is being recorded, sir.
Okay, you save
This
the
event
video, sir, and you have make a snapshot.
Okay, sir. Okay, sir. Sure, sir. Sure, sir.
Thank you for all the participants as well as staff and students. Thank you very much, sir.
Thank you all to all the participants.
Thank you.
Thank you.
So paper presentation students can stay on this particular main group. We'll continue with the presentation. Sriram, take over on the stage. Sriram, are you there?
Sir, yes, sir, I'm here, sir.
Okay.
Sir, sorry for the disturbance, sir. We have created another link for paper presentation event, sir.
On this link,
it's updated in the.
Yes,
sir, the link was posted in the chat box, sir.
1 minute, I'll check it out.
Yes, sir. So the second link, sir, talent in inside.
1 minute, please. Which group have you sent a message?
So we have made the link to all the participants, sir.
You mailed the link to the participants, huh?
Yes, sir.
Which mail ID? My college ID. 1 minute,
No, sir, the event mail IDs.
Yeah, I've not got received any link, pa.
Sir, the meeting link has been posted in the chat box also, sir.
One minute. Okay. This is the domain, logo, PG, talent, DI. Where is our link? You send
Sir,
me
the
in
second
WhatsApp.
link was. Sir, yes, sir.
You send me in WhatsApp.
Sir, I have sent you, sir.
Okay, bye. Take care. I'll join you in that group.
Yes. Okay, sir.
Actually, we have more. I received more emails regarding the links. Can you please send it, sir?
So, which event are you participating, ma'am?
I'm participating in this.
Okay, the link has been posted in the chat box, so you can look into it.
Chat box is not accessible, sir.
So just wait a minute. I will confirm you.
Hello guys, sorry for the inconvenience. The meeting is again will start. You can join that meeting. You can see the chat box. Sorry for the inconvenience. The same meeting will start again soon.
Hello participants, கேக்குதா நான் பேசுறது? Hello.
Yes, Solai.
Participants. ஹலோ பார்ட்டிசிபென்ட்ஸ், நீங்க வந்து இந்த மீட்டிங்லேயே வெயிட் பண்ணாம நீங்க வந்து சேட் பாக்ஸ் ஓபன் பண்ணீங்கன்னா அதுல வந்து ஒவ்வொரு ஈவெண்ட்டுக்கும் ஒவ்வொரு லிங்க் கொடுத்துருப்பாங்க. அந்த லிங்க்ல போய் நீங்க வந்து இன்னொரு மீட்டிங் வந்து நீங்க ஜாயின் பண்ணிக்கோங்க. அங்க அதுக்கப்புறத்துல இருந்து உங்களுக்கு வந்து அந்த ஈவெண்ட் வந்து உங்களுக்கு நடக்க ஆரம்பிச்சிடும்.
Sir, chat box is not visible, sir.
Chat box visible உங்களுக்கு கீழ அந்த chat conversation அப்படியே ஒரு ஐகான் இருக்குமே. ஹலோ
சொல்லுங்க சார்.
கீழ கான்வர்சேஷன் நீங்க போன்ல அட்டெண்ட் பண்றீங்களா லேப்டாப்ல அட்டெண்ட் பண்றீங்களா?
போன் சார்.
போன்னா உங்களுக்கு வந்து டாப் லெஃப்ட்ல chat அந்த மாதிரி.
அது ஓபன் ஆக முடியும் சார்.
சரி சரிங்க, 1 செகண்ட்.
நீங்க வேணா டிஸ்ப்ளே பண்றீங்களா சார்?
அதான் நான் டிஸ்ப்ளே தான் பண்ண போறேன். ஹலோ கெஸ்ட் எல்லாருமே நீங்க வந்து இப்போ உங்க ஸ்கிரீன் லைட்டா டச் பண்ணிட்டு மேல வந்து chat மாதிரி ஒரு சிம்பிள் இருக்கா? டாப் லெஃப்ட்ல சாரி டாப் ரைட்ல டாப் ரைட் பார்ட்டிசிபென்ட்ஸ்க்கு பக்கத்துல ஒரு chat மாதிரி ஒரு சிம்பிள். அதை அழிச்சிட்டு லாஸ்டா ஸ்க்ரோல் பண்ணீங்கன்னா உங்களுக்கு வரும்.
guys நீங்க மீட்டிங் லீவ் பண்ணிட்டு again ஜாயின் பண்ணீங்கன்னா உங்களுக்கு chat box விசிபிளா இருக்கும். இன் கேஸ் உங்களுக்கு விசிபிளா இல்ல chat boxனா நீங்க ஒன்ஸ் லீவ் பண்ணிட்டு திருப்பி அதே மீட்டிங்ல ஜாயின் பண்ணீங்கன்னா உங்களுக்கு chat box விசிபிளா இருக்கும்.
சார் வரல சார்.
நீங்க லீவ் பண்ணிட்டு ஜாயின் பண்ணீங்களா again?
எஸ் மேம்.
Guys, are you able to see the chat box or not?
Not able to see, ma'am.
ஸ்னேகா அந்த லிங்க் சொல்லிடுங்க. அந்த லிங்க் இவங்க நோட் பண்ணிக்கிட்டோம். இதுல ஓரலா சொல்லிடுங்க. அப்படி சப்போஸ் தெரியலனா அந்த லிங்க் வந்து ஓரலா சொல்லிடுங்க. இதுல டீம்ஸ்ல சொல்லிடுங்க. சரி, ஓகே. அந்த இது வந்து திருப்பி போடுறேன். எந்த ஈவென்ட்ல இருக்கீங்க? நான் திருப்பி போடுறேன்.
கோடிகோ சார்.
கோடிகோவா? ஏங்க ஒரே நிமிஷம், இப்ப நான் போடுறேன். இப்ப அந்த லிங்க் போஸ்ட் பண்ணிருக்கப்பா chat பாக்ஸ்ல ஓபன் பண்ணி பாருங்க. டைனி URL https அந்த லிங்க்ல போயிட்டு டைனி யூஆர்எல் அந்த சாட் பாக்ஸ்ல போய் ஓபன் பண்ணி பாத்தீங்கன்னா, இல்லைன்னா நான் டிக்டேட் பண்ணிடுறேன்.
சிம்பிளே காட்ட மாட்டேங்குது சார். ரெக்கார்டிங் சிம்பிள் வருது, பார்ட்டிசிபென்ட் சிம்பிள் வருது, சாட் பாக்ஸ் சிம்பிளே காட்ட மாட்டேங்குது சார்.
சரி சரி, ஓகே ஓகே. நீங்க நோட் பண்ணிக்கங்க, அந்த லிங்க் கொஞ்சம் நோட் பண்ணிக்கங்க.
guys உங்களுக்கு மெயிலும் சென்ட் பண்ணிடுவோம் இப்போ, so you can see your mail also, check also.
சரி, அப்படி இல்லைன்னா எல்லாரும் உங்களோட மெயில வந்து ஓபன் பண்ணி வைங்க. உங்க எல்லாருக்கும் நாங்க வந்து மெயில்ல வந்து நாங்க லிங்க் சென்ட் பண்ணிடுறோம். எதுவும் இல்ல.
அந்த மெயில் இல்லைன்னா இந்த வாட்ஸ்அப் இது லிங்க் எதுல ஈஸியா சிம்பிளா அனுப்ப முடியுமோ
Sir, mail not sent, sir.
Within 5 minutes, we'll send you, Vishal.
Okay, ma'am.
गाइस எல்லாரும் கொஞ்சம் மெயில் செக் பண்ணுங்க. எல்லாருக்கும் எல்லா ஈவென்ட்டோட லிங்க்கும் மெயில் சென்ட் பண்ணிட்டோம். ஸ்பாம் மெசேஜும் செக் பண்ணுங்க. If you have any difficulty, you can report here.
Ma'am, mail not sent, ma'am.
மெயில் சென்ட் பண்ணியாச்சு. கொஞ்சம் செக் பண்ணுங்க. எப்படியும் வந்துரும். இல்ல உங்க ஈவென்ட் கோஆர்டினேட்டர்ஸ் உங்களை காண்டாக்ட் பண்ணுவாங்க. Okay, in which event you have registered?
Logo event, logo, BGMI and one.
இப்போ once chat box செக் பண்ணி பாருங்க வருதானா?
இல்ல மேம், மொபைல் யூஸ் பண்றதுனால chat box வர மாட்டேங்குது.
ஓகே, பார்ட்டிசிபென்ட்ஸ் பக்கத்துல உங்களுக்கு chat மாதிரி எதுவும் காட்டலையா?
இல்ல, நான் வந்து அதர் காலேஜ்ல இருந்து வரதுனால அது மாதிரி காமிக்கல.
ஓகே, நீங்க எந்த ஈவென்ட் லோகோ ஈவென்ட் சொன்னீங்க, அப்புறம் வேற என்ன ஈவென்ட் சொன்னீங்க?
லோகோ ஈவென்ட், அந்த BGMI, அப்புறம் ஒரு குவிஸ் காம்படிஷன் கியூபிள்.
ஓகே, ஈவென்ட் கோஆர்டினேட்டர்ஸ் உங்களை காண்டாக்ட் பண்ணுவாங்க. தே சென்ட் யூ மெயில். ஓகே.
ஓகே மேம்.
மெயில் சென்ட் பண்ணியாச்சு. மேபி கொஞ்சம் நெட்வொர்க் இஷ்யூவால டிலே ஆகலாம். ஆனா எங்களுக்கு சென்ட் ஆயிடுச்சு. உங்களுக்கு கொஞ்சம் ரெகுலரா செக் பண்ணிட்டு இருங்க, உங்களுக்கு மெயில் வந்துரும். And sorry for the inconvenience.
It's okay.